Hi, this is Ted, and for the next hour, you'll be listening to a reading of articles and features from the Monday, March 23rd New York Times on the Niagara Frontier Radio Reading Service. There are a lot of headlines this morning, but my feeling is that you'll probably be able to hear those on television or radio, and so I will try to focus on things that you might not hear. Here's an article I think that's of interest to everyone by Janine Interlandi called A Mass Disaster Nonstop Inside the Turmoil at Robert F. Kennedy Jr.'s CDC. Almost as soon as he recaptured the White House, President-elect Trump announced that he was choosing Robert Kennedy Jr. to lead the Department of Health and Human Services. Kennedy, who had amassed a substantial following while spreading falsehoods about vaccines, first through his nonprofit Children's Health Defense and then through his Make America Healthy Again movement, or MAHA, endorsed Trump after ending his own presidential bid. Trump promised to let him go wild on health. Since his confirmation in February 2025, Kennedy has taken particular aim at the Centers for Disease Control and Prevention, a federal agency charged with safeguarding the nation's public health. He has called the CDC the most corrupt agency at HHS and maybe the government, and vigorously defended mass terminations carried out by Elon Musk's Doge. At least 2,400 employees, or 18% of the CDC staff, have been fired or have resigned since January 2025. Kennedy has said that the CDC, which comprises more than 20 centers focused on a wide range of public health issues, including infectious diseases, foodborne illness, substance abuse, and violence prevention, has grown unwieldy and that its size was undermining its mission. As proof, he has cited the agency's failures during the coronavirus pandemic. We literally did worse than any country in the world, he said at a Senate hearing in September. And the people at CDC who oversaw that process, who put masks on our children, who closed our schools, are the people who will be leaving. Kennedy wants to move large parts of the agency to a new entity, the Administration for a Healthy America, while leaving the CDC to focus on monitoring infectious diseases. The Secretary's critics say that his real goal is not to reform the agency, but to dismantle the nation's vaccination programs, in which the CDC plays a key part. I interviewed more than 40 people who work at the CDC or who left during Trump's second term. Some sources spoke on the condition of anonymity because they feared that speaking out would cost them their jobs or subject them to retaliation from the administration. Many of them acknowledged that the agency's initial COVID response fell short. Its labs failed to develop reliable diagnostic tests, its communications were confusing and sometimes contradictory, and its disease surveillance efforts struggled to stay ahead of the virus's spread. But they say that the CDC has made significant strides in the years since. Now, they argue, agency scientists are being sidelined, political appointees are taking charge, and a vital public health institution is being remade into a vehicle for ideologues. In June, Kennedy fired all 17 voting members of the Advisory Committee on Immunization Practices, or ACIP, a group of doctors and scientists that meets several times a year to develop vaccine recommendations for the nation, and largely replaced them with people who share his views. The former CDC director, Susan Monares, says she was fired for refusing to approve any changes to vaccine recommendations without first seeing the scientific evidence behind them. Kennedy has denied this. Monares was the only permanent director to lead the agency in the past year. She lasted just 29 days. No one has been nominated to succeed her. The Department of Health and Human Services did not make Kennedy available for an interview. In response to my requests for a comment and a detailed list of questions, Andrew Nixon, a department spokesman, said in a statement, within a year, Secretary Kennedy restored the CDC on its core mission of fighting infectious disease by eliminating mission creep and replacing leaders who resisted reform. I also reached out to the White House for comment. The Trump administration is focused on restoring the public's trust and accountability in public health bodies like the CDC by reestablishing gold standard science as the only factor behind policymaking, said Kush Desai, a spokesman. The civil servants who spoke to me worry that instead, a century's worth of expertise is being lost, leaving Americans increasingly exposed to a wide range of health threats. November 14, 2024. Anticipating his cabinet position as Secretary of Health and Human Services, Kennedy wrote on X, "I look forward to working with the more than 80,000 employees at HHS to free the agencies from the smothering cloud of corporate capture so they can pursue their mission to make Americans once again the healthiest people on earth." Deborah Houry, former Chief Medical Officer. I read Project 2025. I read the American Enterprise Institute reports. I read 3 of RFK Jr.'s books. I took notes. What are the criticisms? What are their recommendations? I sent them to each center that was impacted. I'd say, explain this to me. Is this true? How should we address this? When I met with the Trump transition team, instead of doing the usual CDC 101 to walk them through the budget and the programs, I framed it around the progress we had made since the first Trump administration. We put electronic case reporting technology into tens of thousands of hospitals so that they could share data in real time. We built wastewater monitoring programs to track potential outbreaks, and we were working with the private sector to scale up laboratory capacity. Jonathan Mermin, former director of the National Center for HIV, Viral Hepatitis, STD, and Tuberculosis Prevention. We had worked closely with Dr. Robert Redfield, who led the CDC during the first Trump administration, to design and implement the Ending the HIV Epidemic initiative, and we were very excited to share the results because it was such a win-win. New infections went down, health equity improved, and money was saved. We were hopeful they'd want to continue that. Tom Simon, former Senior Director for Scientific Programs in the Division of Violence Prevention. We anticipated it being rough, but the first Trump administration really wasn't that bad for our team. It was then that we got our first appropriations in many years for gun violence prevention research. A government advisor. The thinking was that we could work on those who were most skeptical and try to bring them along. Maybe the CDC wouldn't look exactly like it had when Mandy Cohen was director during the Biden administration, but we could advance our priorities. Then there was a meeting with Kennedy and Matt Buzzelli, the CDC's new chief of staff, and it went terribly. And not because of Matt. Matt went in with talking points about the value of the staff and how they're world experts. And the first thing Kennedy said was, "How do you know they're good people?" January 20th, 2025. On his first day in office, Trump issued a flurry of executive orders. One ended federal diversity, equity, and inclusion initiatives, and another defended women against gender ideology extremism, whatever that is. CDC staff members were told to scrub any references to identifying pronouns and terms including transgender and pregnant people from the agency's website. Hundreds of other words, including diversity, health equity, disparity, trauma, and women, were also flagged. Entire pages were quickly taken offline in an effort to meet compliance deadlines. Deborah Houry, former Chief Medical Officer. The guidance we were given by our political leaders was to err on the side of caution and overinterpret these executive orders. We took down some of the immunization information on Mpox because it had the word transgender in it. Then we were asked by HHS and our political leadership at CDC to put it back up because Kennedy was about to go through his confirmation hearings. They were concerned it would look like there were questions around his support of vaccines. Meanwhile, the things that we would want the CDC to do, like helping states respond to outbreaks or implementing various public health programs, were not really happening because so much of the agency's time was being spent on scrubbing the website. Someone from the HHS communications team said, "Well, don't you do this every 4 years, changing the priorities and things like that?" I said, "Science doesn't change based on who is in office." Tom Simon, former Senior Director for Scientific Programs in the Division of Violence Prevention. There was an executive order about defending the Second Amendment that called on the Attorney General's office to examine how federal agencies interfered with gun owners' rights. Political appointees from HHS sent us a blank spreadsheet and asked us to fill in which of our programs interfered with gun rights. I told them we only evaluated prevention strategies to see if they worked. We had no authority to regulate or prohibit anything. They took down the first ever Surgeon General Advisory on Firearm Violence written by Vivek Murthy, the Surgeon General who served under Obama, Biden, and the first Trump. You're trying to move the field forward, and you start to see very quickly that, wow, we're not just losing momentum, we're going backwards. Jonathan Mermin, former director of the National Center for HIV, Viral Hepatitis, STD, and Tuberculosis Prevention. It seemed like someone had just run an AI algorithm to find any program with the word equity in it. You couldn't even say that certain populations are more likely to get HIV or sexually transmitted infections. When you explain the concept of health equity to people who are against DEI, most would say health equity is still consistent with what they consider appropriate work. But we didn't have that chance. A maternal HIV specialist. Some of the changes the executive orders required didn't really affect the work. You changed diversity to variety, but you're still doing the same thing. But gender-based violence was really hard. Sex-based violence sounds like sexual violence, and gender-based violence is not always sexual in nature. The idea of gender-based violence is that there are gender roles and gender dynamics that lead to violence. If you can't acknowledge that there is such a thing as gender, it's really hard to talk about. January 22nd. The acting director of HHS issued a directive that all public communications had to be reviewed by a presidential appointee or designee before being released. As a result, CDC meetings were canceled, the publication of research data was delayed, and CDC staff members were told that they could not speak in any official capacity. The administration described this as a short pause so new staff members could establish communication priorities. The directive was officially lifted after 10 days, but CDC employees say the effect of the strictures lingered for months. January 24th. The Trump administration issued a formal stop work order for virtually all foreign aid, including funds dispersed by the United States Agency for International Development. It had also begun the process of formally withdrawing the U.S. from the World Health Organization. The CDC's global health initiatives relied heavily on funding from USAID and collaboration with the WHO. Daniel Jernigan, former director of the National Center for Emerging and Zoonotic Infectious Diseases. There was no understanding of the connectivities between the U.S. government and WHO. There was magical thinking that you could build a bilateral set of relationships that would take care of what WHO is doing. For flu, we had 57 different bilateral cooperative agreements with countries. But to make things happen, we went through WHO because they have the ability to bring people together. Without WHO involved, there's an uncertainty among some nations about whether or not to work with the United States at all. Ebola is one example of how this works. Do we hear about cases because we have given money to a country's Ministry of Health and they're required to let us know? No. We hear about them because we have people who are doing contract services out in the forest, or we've got people who have spent 15 years working on the same projects. The loss of that soft surveillance is really significant. CDC also did a lot of work on malaria through USAID, and that work was all stopped. We already have some 2,500 travel-required malaria cases in the U.S., and 2 years ago we had 10 cases of local transmission. Those numbers will increase now, and the costs of dealing with malaria will go up, especially in places like Florida, Puerto Rico, and Texas. January 30th. At his Senate confirmation hearing, Kennedy said he wanted, quote, gold standard science to set the nation's health policy and was open to being proved wrong. He also insisted that despite his work for children's health defense, supporting lawsuits against vaccine makers and promoting vaccine disinformation, he was not anti-vaccine. I support the measles vaccine, he said. I support the polio vaccine. I will do nothing at HHS secretary that makes it difficult or discourages people from taking it. A governmental advisor says. There was a big meeting to help him prepare for his hearings. And one goal was to get him riled up and teach him to stay calm and collected under question. And he had no interest in that or in listening to expertise. For instance, people tried to explain what ACIP was and why some of the things he was saying didn't make sense. He wanted to address vaccine safety by changing ACIP, but the initial safety determination is made by FDA, not CDC. Instead of listening, he just said, "No, you're wrong." Daniel Jerrigan says, "We were all avidly following the hearings, and we were encouraged when Kennedy said that he was going to leave his presuppositions at the door and work collaboratively with scientists and epidemiologists and others, but we never heard from him after that." February 26th. An unvaccinated child in West Texas becomes the first to die from measles in an outbreak that had been spreading for months across the region. In cabinet meetings and television appearances, Kennedy downplayed the outbreak as not unusual. He did not outline what steps his department was taking to contain it, and instead of promoting vaccination as a means of preventing infection, he recommended a range of unproven treatments, including cod liver oil and antibiotics. The former chief medical officer, Deborah Corey, says, "We did get the secretary to put out some tweets that were positive about vaccination, but while speaking to the media, he would talk about deaths from vaccines, saying things like, 'I understand why some parents don't want to inject their children with fetal parts.' I said to our political leadership, I really want the secretary to be successful. However, when he says that there are fetal parts in vaccines, it doesn't help him look like he knows what he's talking about. So how can we ensure he has the talking points that he needs?" And one person in the team said, "I thought there were fetal parts in the vaccine." And I said, "No, there are not." Deborah Daskalakis, former director of the National Center for Immunization and Respiratory Diseases, says, Kennedy's deputies would come and talk to CDC in this way, in this very kumbaya way. "We really love you all. We think you're so amazing. Talk to us and we'll make sure that we can make things happen." And every time they did that, I would say, "We've never briefed the secretary. We would love the opportunity to talk to him about vaccine preventable diseases, about measles, about flu, about COVID." And they would say, "Well, thank you so much. Just reach out." And then when we reached out, we would get crickets. Kennedy then went, unbriefed, to his first cabinet meeting and got the numbers wrong on measles. We'd had one death at that point, and he said there were two. We went into a tailspin, reaching out to every jurisdiction to figure out if there had been a second death. There hadn't. Then he said that measles outbreaks were not a big deal. I've never seen my team look so deflated. And you're listening to a reading of articles and features from the New York Times on the Niagara Frontier Radio Reading Service. March 25th. After being appointed acting CDC director by Trump in late January, Susan Menares was officially nominated to lead the agency. She would be the first prospective director required to secure Senate confirmation, owing to new rules established during the Biden administration. She would also be the first director in more than 70 years without a medical degree. While her confirmation was pending, she stepped away from her position as acting director as required. But her brief tenure had coincided with a round of firings and executive orders that left agency employees rattled and deeply skeptical of her leadership. One advisor says Susan had been under an enormous amount of pressure to give HHS a plan for dismantling the agency. They wanted to fold everything except infectious diseases into a new so-called Administration for a Healthy America. She managed to extract promises that they weren't going to dismantle chronic disease, even if it moved. But the real driver was Rachel Riley, DOJA's representative at CDC. When they were firing people, Riley would print out spreadsheets and say, "Okay, tell me the names of the people you want to stay, and I'm getting rid of everyone else." She would say, "Do this, this, and this in the next 12 hours, or the next 20 hours, which, if you're new to the agency, is just the dumbest way. It leads to things like the National Institute for Occupational Safety and Health being eliminated without anyone thinking of the consequences. And then when things went wrong, they would get mad. Why did this happen? And it's like, well, you put a gun to our heads." April 1. The administration laid off thousands of federal health workers including at the CDC offices devoted to sexually transmitted diseases, workplace safety, and violence prevention, among other projects, suffered heavy losses. Kennedy said his goal was to shrink the agency to a few departments focused on infectious disease monitoring and to shift all other programs to the proposed Administration for a Healthy America. When he was later called to testify before Congress about the large cuts to HHS, he said, "We are under a court order not to do any further planning on the reorganization, and I've been advised by my attorneys not to comment, but I will just say broadly, many of the programs that Democrats are now saying were cut at the CDC were not cut at all." Deborah Horry, former chief medical officer, says, "I called every one of my center directors together, including those who were being fired that day, and we walked through all their programs. Do we have people deployed overseas that we have to be concerned about? What data systems are shutting down?" And I just had a pit in my stomach. At the end, I cried. You think about programs that are needed for the nation that are just going away. Vi Lee, behavioral scientist for violence prevention, says, "I did research on sexual violence and how to prevent it. We had programs that were proven effective over and over at reducing multiple forms of violence, including teen dating violence, bullying, sexual violence. We had rape prevention programs. 3 out of 4 branches were basically wiped out. Entire programmatic areas, things that were congressionally mandated, just gone." I'm skipping a number of comments because this is a very long article. Kennedy vowed to find the cause of autism by September. HHS promised to leave no stone unturned in determining why the disorder is on the rise. A few weeks earlier, Kennedy hired David Geyer, a prominent vaccine skeptic who was sanctioned by the Maryland State Board of Physicians in 2012 for treating autistic patients without a medical license, to lead this effort. Geyer has no medical degree or scientific credentials, and his research has been widely discredited. Kennedy defended Geyer in a post on X. Most experts agree that the increased incidence of autism is largely due to expanded diagnostic criteria and better overall reporting, and that autism itself is most likely caused by a mix of factors, including genetic and environmental ones. But Kennedy and Geyer say that vaccine ingredients like the preservative thimerosal are the culprits. Abby Tai, former public health advisor in the Division of Overdose Prevention, says, "There was a lot of frustration that the administration was cutting research into environmental exposures, into chronic health conditions, birth defects, etc. And then you have Kennedy acting like there hadn't been people trying to understand the rise in autism. The difference was that the scientists were focused on where the research led them, and RFK was focused on an outcome. He wants to say vaccines cause autism, and he's working backward from there, and that's not how science works." Elizabeth Soda, a medical officer for Immigrant and Refugee Health, says, "To an average person, that sounds amazing. Like, finally, this guy is going to get to the bottom of things. But to make a claim that in 4 or 5 months you're going to find the cause proves that Kennedy has no idea what he's doing. No scientist would ever make a statement like that." Mid and late April, the measles case count topped 800 nationwide. CDC officials acknowledged that the outbreak, which was spreading in Texas, Oklahoma, and New Mexico, was the largest since the disease was declared eliminated in the United States in 2000. Some 70% of cases were in children, and a vast majority were among those who had not been vaccinated or whose vaccination status was unknown. Says Flora Havers, former medical epidemiologist in the Respiratory Viruses Division, "It's not a coincidence that the high number of measles cases and the fact that we may lose our measles elimination status coincide with the first year that a leader of the anti-vaccine movement has been overseeing the nation's health agencies. They're out there talking about the often spurious harms of vaccines while saying nothing at all about the very real dangers of the diseases that vaccines prevent." Dmitry Daskalakis says, "Even as the outbreak grew, RFK was still just praising the doctors who were giving snake oil treatments like budesonide, a corticosteroid, and clarithromycin, an antibiotic to kids with measles, and saying how they saved hundreds of lives, which was absolute garbage. We were asked to add those treatments to the measles guidelines. We managed to mitigate that by including the words on the guidelines, but saying that none of these were proven. Giving people the wrong medicines delayed lots of care for kids. Meanwhile, we were learning about pivotal things related to the outbreak by watching the Children's Health Defense website. Whatever they said, he would repeat. Back in 2018 and 2019, when I was at the New York City Health Department, we were trying to control a measles outbreak in the Hasidic communities. The Children's Health Defense backed a lawsuit against vaccine mandates. It felt like the people who had once sued us were now running the entire country's health department. May 14th, in his first Senate hearing since taking office, Kennedy defended the mass layoffs across HHS in heated exchanges with Democrats. When he was asked who was leading the CDC, he named Matthew Buzelli, the chief of staff. According to employees, the agency had been leaderless since Monaris stepped away in late March, pending her Senate confirmation. The chief medical officer says, I started to worry that nobody was really in charge and that none of them knew what was happening. The political appointees were still shutting things down and trying to move random divisions into this new administration for a healthy America, which didn't even exist. I kept flagging that there's a mine, a missile silo, and toxic chemicals that they use for experiments that need to be dealt with as part of any transition. I never got an answer. They also had a lot of lab animals. Their entire West Virginia campus had been shut down and their veterinarian had been fired, and we had a limited amount of time to transfer or euthanize the animals before we were out of compliance with animal safety laws. We sent it up to HHS so many times, and I even verbally briefed them. Eventually, we sent a note saying if we don't hear back by 1 p.m., we're going to have to do an emergency shutdown. And we didn't hear back. And so we had to euthanize many animals. This article goes on for quite a while, but the tenor of it is all the same. So I think you probably get the idea, and I will move on to something else. And as long as we're doing disturbing things, here's an article called Jewish and Muslim People Face a Wave of Hate. Can Schools Turn the Tide? By Troy Clausen. It was anything but an average U.S. history lesson. In room 406 of an all-girls public school in Brooklyn, seventh graders learned about enslaved women and their resistance, hearing familiar names such as Ona Judge, who escaped George Washington's Philadelphia mansion in 1796 and evaded his efforts to recapture her. Then their teacher turned to a more obscure duo who were held by Washington at Mount Vernon, but have rarely appeared in American textbooks, a mother and daughter known as the Fatimas. It ignited a discussion about the widespread capture of Muslims from West Africa during the transatlantic slave trade and how their faith shaped their enslavement. How did Islam allow them to resist? The teacher, Manjot Kara, at the Urban Assembly School for Leadership and Empowerment, asked one recent afternoon during Ramadan. They were praying, one student replied, but they had to keep it secret, another student chimed in. The exercise was a window into a fresh set of lessons on Muslim and Jewish American history, rolling out across New York City, the nation's largest public school system, at a time when U.S. cities are struggling to quash a rise in hateful harassment, vandalism, and rhetoric. The United States has witnessed a surge in anti-Semitic episodes in recent years. More than half of all reported hate crimes in New York City in 2025 were against Jewish people, and the ascension of Mayor Zohran Mamdani as the country's most prominent Muslim elected official has cast a spotlight on long-standing and growing Islamophobia. The city's new endeavor asks whether schools might hold the answer to changing course. Mr. Kara's class is part of a project that emerged as districts grappled with high-profile episodes of anti-Semitism while the war in Gaza raged. Some families worried that too many children were learning about history from TikTok and social media feeds than from behind their school desks. For millions of students, Jews and Muslims will never become a focal point of classroom discussion beyond World War II and basic Venn diagrams comparing the three major world religions. As districts were criticized for failing to meet the moment, many turned to training and workshops. Maryland started mandatory anti-bias education for school employees. Chicago sent staff members to mediate conversations with students at schools where tensions rose. The effort in New York City stands out as a novel approach, rooted in the idea that exposing children to a broader view of the contributions of Jews and Muslims to society will offer a more complete picture of the American story and serve as a potent way to root out intolerance. And you're listening to a reading of articles and features from the New York Times on the Niagara Frontier Radio Reading Service. I don't know of any other large district in America doing something like this, said Mark Traeger, the chief executive of the Jewish Community Relations Council of New York, which partnered with the school system to develop the lessons. At least 33 schools signed up for a pilot program this year, and the coursework is expected to roll out more broadly next fall. It's not mandatory or part of a new elective, but rather provides materials that teachers can occasionally introduce into social studies periods throughout the year. It remains an open question whether the lessons will be taught widely or simply collect dust on bookshelves. Natalia Melman Petruzella, who was the lead scholar helping to develop the Jewish American history materials, said that too often the only place kids in secular schools will encounter Jews is either in education about the Holocaust or training after an anti-Semitic incident. These are very important interventions, Dr. Melman Petruzella said, but this is fundamentally different. At Edward R. Murrow High School in Brooklyn, teenagers recently spent social studies class diving into the legacy of Rose Schneiderman, the labor organizer who helped set the stage for the biggest U.S. strike of women workers at the time. Most of the students were not Jewish. They analyzed Ms. Schneiderman's legacy as a Polish Jewish immigrant in small groups and assessed the consequences of World War I for women on the American home front. It allowed women to contribute, one student said, but at what cost? What's the point of giving them opportunities if they're not treated the same as men? Another interjected. As fourth period wound down, their teacher, William Bachbot, shouted, "Wrap it up, wrap it up." He had to wait about 4 seconds for students to stop talking about the lesson. After class, he said that many had appeared to engage in a way they had not when history was taught in such a narrow-minded way. Other issues examine American society through a broad lens. During a class on immigration, fourth graders in the Bronx might study Emma Lazarus, who spoke out about the plight of Jewish refugees who were fleeing pogroms in Eastern Europe. She wrote the poem that is inscribed inside the Statue of Liberty. In a unit on Reconstruction, eighth graders in Harlem might discuss Ernestine Rose, the reformer known at times as the first Jewish feminist, who lost her faith in Judaism. And when learning about race in early America, teenagers on Staten Island might read about Abdul Rahman Ibrahima ibn Sori, an African prince enslaved in Mississippi whose Muslim identity shaped his quest for freedom. Edward E. Curtis, who led development of the Muslim American history materials, said that while public conversations about Muslims play an outsized role in shaping policies and culture, they are almost always devoid of any sense of history. The new lessons introduce pupils to important Americans who also happen to share the same faith. That's a different focus than always seeing Muslims through the prism of their religion, said Dr. Curtis, the director of the Arabic and Islamic Studies program at Indiana University. Back at the Urban Assembly School, Mr. Khera said that he had regularly fielded questions about why his class had failed to learn about Muslim and Arab historical figures more often. A number of his students practice Islam. One student, a relatively recent arrival to the U.S., is typically less outspoken than her classmates during discussions, but she perked up during the lesson on the Fatimas, calling her teacher over. She had eagerly pointed out a connection. Her name was part of the stories from more than 250 years ago. Mr. Karen knelt down beside her. "What does that tell you about your mom?" he asked quietly. "How much does she believe in her religion if she picked that name for you?" She smiled as he walked away from her desk. And here's an editorial by Senate Minority Leader Chuck Schumer, what the SAVE Act would really do. The Republican effort to undermine the 2026 midterm elections is neither theoretical nor exaggerated. A coordinated, multifaceted campaign is underway including the attempt to pass the Save America Act, which narrowly passed the House last month and which the Senate started debating last week. President Trump has not been coy about his motivations. He said if Republicans pass the SAVE Act, it'll guarantee the midterms. Republicans like to pretend that the SAVE Act is a voter ID bill. Though on the surface it appears to be one, something far more insidious lies beneath: a system for purging eligible voters from the electorate, voters who are disproportionately likely to vote against Republicans. In the bill, voter ID comes into play only at the very end of a process designed systematically to disenfranchise Americans. This purge would begin with the Department of Homeland Security. Under the SAVE Act, every state would be required to turn over its voter rolls to the department, an extraordinary federal intrusion into the state administration of elections. It would hand Washington control over voter eligibility, which Democratic and Republican-led states have long resisted. The next step would involve running the voter rolls through an algorithm that would ostensibly root out non-citizens, a program overhauled by Elon Musk and his so-called Department of Government Efficiency, which has already proved dangerously unreliable. In a trial run of the program in Boone County, Missouri, more than half of the voters flagged as ineligible were, in fact, eligible American citizens. County clerks in Texas also found many examples of wrongly identified voters. Citizens were removed from the voter rolls anyway. This is not about stopping widespread voter fraud, which is a myth pushed by Republicans in the first place. Rather, it's about giving the Department of Homeland Security power to choose who can vote. Don't forget that Kristi Noem, the disgraced former secretary of the department, said that it was working proactively to make sure we have the right people voting, electing the right leaders to lead this country. The third step would be to leave purged voters in the dark about what has happened. Under the SAVE Act, if you are purged from voter rolls by the federal government, you may not know that this has occurred until you show up to vote. The bill imposes no requirement that voters be notified if they're purged. Imagine this happening hundreds of thousands of times across the country on election day. It would cause pandemonium. Lastly, the bill would impose voter ID requirements, not as a safeguard against fraud, but as another barrier to voting. For those who had been wrongly purged from the voter rolls, the SAVE Act would make registering again a bureaucratic nightmare. No longer would a driver's license or another state-sanctioned identification suffice. They would instead have to produce a passport, which only about half of Americans have, or a birth certificate, which many cannot easily access. For a married woman who changed her surname and whose married name doesn't match her birth certificate, even a birth certificate may not be enough. Some 20 million American citizens lack the required documents to prove citizenship under the SAVE Act. The bill would also dismantle the most common and accessible ways to register to vote. Mail-in registration, gone. Registering at churches and college campuses, illegal. Registering when you get your driver's license or sign up for Social Security, no more. Under the SAVE Act, the only path to register to vote would be in person at a state or local election office. The burdens of the SAVE Act would fall most heavily on the socioeconomically disadvantaged, the working class, and voters of color. They would fall on Americans who cannot spend hours navigating bureaucratic obstacles, on older people who depend on voting by mail, on those without passports, on rural communities far from election offices. In other words, millions of everyday Americans. Trump knows his administration is not delivering for the American people. Costs are rising and instability is increasing at home and abroad. Instead of changing course, he's attempting to change the electorate. Democrats are united in opposing the SAVE Act. We know the right to vote is not a partisan advantage to be engineered or withheld. It is the foundation of American democracy. And here is an important essay by the editorial board. It's called Trump is Hiding the Truth About the War in Iran. From his first announcement of the attack on Iran on February 28th, Trump has issued a stream of falsehoods about the war. He has said Iran wants to engage in negotiations, though its government shows no sign of it. He has claimed that the U.S. destroyed 100% of Iran's military capability when Tehran continues to inflict damage throughout the region. He has said that the war is almost complete, even as he calls in reinforcements from around the globe. Lying is standard behavior for Trump, of course. His political career began with a lie about Barack Obama's birthplace, and he has lied about his business, his wealth, his inauguration crowd size, his defeat in the 2020 election, and so much more. A CNN tally of Trump's falsehoods during one part of his first term found that he averaged 8 false claims per day. Many people are so accustomed to his lies that they hardly notice them anymore. Yet lying about war is uniquely corrosive. When a president signals that the truth does not matter in wartime, he encourages his cabinet and his generals to mislead the country and one another about how the war is going. He creates a culture in which deadly mistakes and even war crimes can become more common. He makes it harder to win by hiding the realities of conflict and by making allies wary of joining the fight. Ultimately, he undermines American values and interests. There is a reasonable debate to have about the wisdom of this war. Iran's murderous government does indeed present a threat to its own people, to its region, and to global stability. Trump could make a fact-based argument for confronting the regime now, especially to prevent it from menacing its neighbors and above all from developing a nuclear weapon. We're skeptical, but we acknowledge that there is a case to be made. Trump is not making it. Instead, he has lied about the reasons for the war and about its progress in an apparent attempt to disguise his poor planning and the war's questionable basis. The president was only a few minutes into his February 28th announcement of the start of the conflict when he offered an obviously contradictory rationale for it. He repeated his claim that American attacks last June had obliterated Iran's nuclear program while also citing that program as a reason to go to war. The claim of obliteration is false. Iran retains about 970 pounds of highly enriched uranium, potentially enough for 10 warheads. The lies have continued since then. Days later, Trump said the U.S. military had a virtually unlimited supply of high-end munitions. The Pentagon, nevertheless, has had to withdraw weapons from South Korea to sustain its efforts in the Middle East. He has also asserted that nobody believed Iran would retaliate by attacking Arab countries. On Monday, he said that no, the greatest experts, nobody thought they were going to hit neighboring countries. In truth, some experts had warned of precisely this scenario. In another instance, Trump has used false information to continue his alarming penchant to portray people who contradict him as un-American. Last weekend, he posted an allegation that Iran, working in close coordination with the fake news media, had spread fake videos of an American aircraft burning in the ocean. The White House has offered no examples of American media outlets having done so. Instead, several debunked fake online videos, CNN reported. Nonetheless, Mr. Trump wrote that you can say that those media outlets that generated should be brought up on charges for treason for the dissemination of false information. A shocking falsehood came on March 7th when Trump claimed in his typically offhand way that a strike on an elementary school in the town of Minab during the first hours of the war was done by Iran. The attack killed at least 175 people, most of them children. The U.S. military has conducted an investigation and preliminarily concluded that an American missile mistakenly hit the school. The military deserves credit for its honesty. The commander-in-chief, however, still has not retracted his statement. This pattern is an echo of the wars in Vietnam and Iraq, when small lies grew into bigger ones, such as the cover-up massacres in My Lai and Haditha. The consequences of those untruths were long-lasting. Americans' faith in government never recovered from the deceptions of Vietnam, and the Second Iraq War, which George W. Bush's administration sold on the grounds of fictitious weapons of mass destruction, represents the start of our cynical modern political era. Since that war began in 2003, every Gallup poll asking about the country's direction has shown that most Americans are dissatisfied with it. Lies about war also make it harder to achieve victory. The more one spreads falsehoods, the less one feels obliged to face reality. In retrospect, Americans understand that their leaders' refusal to confront the truth in Iraq and Vietnam led to strategic errors. The pattern is repeating. Before Trump began this war, he brushed aside warnings from his top military advisor that Iran could close the Strait of Hormuz to traffic it does not approve. The global economy is now dealing with the consequences of his overconfidence. You're listening to a reading of articles and features from the New York Times on the Niagara Frontier Radio Reading Service. He may yet learn a more personal lesson about lying in a war. Lyndon Johnson and George W. Bush will forever be remembered as having misled Americans about U.S. military action. They learned that falsehoods can boomerang on the leaders who tell them. Starting a war is the most serious action that a political leader can take. It ends lives and can change history. The decisions that guide war must be based in reality, and presidents owe American service members and their families the truth about why they are being asked to fight. Whatever short-term gains Trump thinks he's getting by lying about the war in Iran is far exceeded by the cost for him, the country, and the world. And Nicholas Kristof writes, the $1.3 million a minute war. Let's ponder for a moment the vast sums that we're pouring into the war with Iran. The Pentagon has requested $200 billion, more than $1,400 per American household, to fund the war, but even that understates the total cost. Linda Bilmes, a Harvard expert on financing war, told me that most of the costs will arrive later. For example, any soldier who develops a medical disorder or aggravates an existing one will receive lifelong benefits in medical care. If today's troops claim such benefits at the same rate as those who participated in the 1990-91 Gulf War, that alone would eventually cost at least $600 billion, she said. Not to mention, of course, the human toll of all of this. All told, she expects this Iran war to cost taxpayers more than $1 trillion. Here are some ideas of what the war money could be used for instead. My calculations are conservative, based on Pentagon reporting that the first 6 days of the war cost $11.3 billion, and even that incomplete tally amounted to more than $1.3 million a minute. For a bit more than 2 weeks of this war, we could offer free college education to every American family earning less than $125,000 annually, at a cost of around $30 billion a year. For less than 3 weeks of war, or $35 billion, we could run a nationwide pre-K program for 3 and 4-year-olds. For $75 million, about an hour's worth of war, we could provide 3 free books to every child in America who's living under the poverty line, according to Kyle Zimmer of First Book, a nonprofit that works on early literacy. Research suggests that books like these can help get children reading and improve their outcomes. A woman dies in the United States every 2 hours on the average from cervical cancer. Screening all uninsured women who need it would cost perhaps $1 billion and could save hundreds of lives, according to Dr. Linda Eckert, a cervical cancer expert at the University of Washington. That's less than 13 hours of the war bill. We could get glasses to all 2.3 million low-income school children in the U.S. who need them but don't have them. The base cost would be about $300 million, according to Vision to Learn, a nonprofit that does this work. The bill would be what we spend on 4 hours of this war. For about $34 billion a year, less than 3 weeks of war, we could restore health insurance subsidies that the Trump administration allowed to expire last year. One analysis predicted an additional 8,800 preventable American deaths as a result. The war money would save even more lives if we allocated part of it abroad. Indeed, we spent more on the first 3 days of war than we spent, $4 billion, on all humanitarian aid in 2025. Consider what we could achieve internationally. For $400 million or less, a bit more than 5 hours of war, we could deworm all children in need worldwide, according to Evidence Action, a nonprofit that works on deworming. This would result in stronger, healthier children and adults. For $380 million, less than 5 hours of war, we could provide vitamin A supplementation for the 190 million children who need it. Helen Keller International, a nonprofit engaged in this work, says this would prevent up to 488,000 child deaths each year and virtually eliminate blindness from vitamin A deficiency. About 1 day's worth of war spending could save more than 350,000 lives from malaria through a rigorously studied screening and prevention program, according to Esther Duflo, an economist at MIT's Abdul Latif Jamil Poverty Action Lab. For 4.3 billion, less than 3 days of the war bill, we could largely end the most terrible form of malnutrition called severe wasting. That would save about 1.5 million children's lives annually. We would accomplish something historic. For the first time in the history of humanity, large numbers of children would no longer be starving to death. We have to know that numbers like this are never totally reliable. That's true of military costs as well. George W. Bush's administration in 2003 put the cost of the Iraq war at $40 billion. It ended up costing perhaps $3 trillion. Moreover, my figures are based on only the initial cost of the Iran war, and even the estimate of $1 trillion for the full cost doesn't include the bills for more expensive gasoline that we're now paying and for pricier fertilizer and food that are likely soon. If we reallocated this war spending to needs at home and abroad, Americans would have access to school from pre-K to college and would have health insurance, and large numbers of children worldwide would not starve to death, and we would still have billions of dollars left over. We can cough up the cash when there's political will, such as to drop bombs halfway around the world. But where is the political will to get people health care or education, to build rather than to destroy? And you've been listening to a reading of articles and features from the New York Times on the Niagara Frontier Radio reading station. I'm sorry that all of these articles that I read today were downers, but the news these days is a downer, I guess. So I don't know if I can say I hope you enjoyed it, but I hope that you got something out of this. And I will speak with you next week. Thank you for listening. This is Ted. Bye.